continued public hearing on recreational marijuana bylaw. Gosh, what's the day today? Monday, February 26th. We're gonna, I just think, as far, well, you guys want to open your meeting first?
Someone give me a motion to
Move
reopen.
to open the ordinance subcommittee meeting.
Second.
All in favor?
Aye.
We're good.
So just as far as management of what's going on, I think I would suggest that we start with Jeff Bagman, new city planner, going over some of the stuff that he's raised as far as previous drafts, and then opening it for more public comment. I would like to finish off the people that signed up at the last meeting on the list, and then I think it makes sense to call on people randomly. I know there were some issues with access to the list. I also think that we should probably cap the amount of time for public comment. I think an hour makes sense. If anybody has any other suggestions, I'm open to that. So I think because of the time limit, rather than be a race to the list for who gets to talk, we can sort of generally select people at random.
Can I ask if people spoke at the last meeting that they,
Yes.
if we give priority to the people in the audience?
I
that
would
haven't
urge
spoken yet?
people not to speak again if you spoke at the last hearing. There's a smaller group here, I guess. It's possible that we'll have time for everyone to talk a little more, but there's also the process, just to remind everyone, this version that we approve, whatever it is, will go to the city council for final approval. They'll have a public hearing process, so this isn't even your last time to speak. So with all that said,
Just
Yes,
one point. Last time, it was my fault. I let some rules of decorum slide, and I'm not going to do that tonight. So if you address this table, you're addressing this table. You're not addressing a specific person at the table. I just want to make that really clear. Thank you.
yeah, and I think if we can also try to focus on the specifics of the draft ordinance and what's coming into play here, I think that that's something that all of us are looking for more insight and guidance on from the public, and that would be helpful. A little less of the sort of overarching comments and support or critical comments, but focusing more on sort of the logistics of some of the things that we're talking about and trying to hash out here. That'd be really helpful.
Jesse?
Yes.
After Jeff, Owen has we've gotten a couple of emails that need to be read into the record.
Yeah, I think we'll start with those. I have a couple as well.
Okay.
And then I want to go, I think there's 5 or 6 people that signed up last time that didn't get to go.
And I would like to make an opening comment as well.
Okay, all right.
2 or 3 hours long.
You have to outdo me every time.
Well, I'll think of that at 9:45.
Somebody can go like this and
Yeah.
I'll stop.
Gone.
All right, so Jeff, have you seen the latest draft?
No.
Let's
That's
put
I sent
together.
it to you yesterday.
Yes.
Dated
Yesterday?
2/25 at the
Okay,
paper.
yes.
Yes.
So I did glance at that. It had a new date on it, so yes.
Okay, so do you want to go over, and you prepared a memo earlier, there were some issues, comments, questions, that sort of stuff. I don't know if you want to either go through that or just go through the draft, however you think best to sort of raise planning questions,
Yeah,
thoughts.
I think I will take a swing through the memo.
Okay.
Knowing that quite a few of the items have been addressed or touched upon, so
Yeah.
maybe if I can just go through the memo and highlight the key things from the planning perspective, and then maybe would it make sense for Councilor Derby to go over some of the changes in this draft from the last meeting?
Sure,
So,
I could do
That
that.
sounds good.
So just by way of introduction, my name is Jeff Bagg. I'm the new city planner. I am a resident in Easthampton. I've also been a professional planner for about 15 years, and I worked for the town of Amherst. And then my current role, which I'm ending, is for the Central Mass Regional Planning Commission, where one of my duties and jobs over the past year and a half was to provide technical assistance to the 39 towns in Central Mass on implementing the recreational marijuana law. So I am not really Johnny-come-lately here. For quite a while, I was following what Easthampton was doing and using it to help provide a framework for other towns as what's going on. I did watch the last hearing from the 20th, I think it was, and I have been following some of the other work that these boards have been doing over the past several months. So I'm pretty aware of what's happening. I didn't plan for this, but I would want to start off with saying that the state regulation structure is under consideration. So the Cannabis Control Commission is this week, Monday, Tuesday, Wednesday, holding policy hearings. And I think it's worth starting off with that today. There was an article in Mass Live this afternoon, but having listened to the hearing today, they talked about cutting out on-site consumption, social consumption, and delivery from the draft regulations for some period of time. So what they talked about was creating a study period, and they set a preliminary timeline of approximately 1 year to have draft regulations specifically for social consumption and delivery. So that will come up, I think, throughout the night, but I did want to start with that because that is one of the more complicated issues that I don't think I have to talk about it from my memo, at least at this point. So I have a memo here dated February 20th. It should be available to those who are interested. I tried to use one of the previous drafts, possibly the 211 version is what was referenced, and also the planning board draft from December. What I tried to highlight were some technical aspects and some policy questions that the boards should at least be aware of. The first item, I can try to do this in 10 minutes, and I know that you guys covered some of the recommendations in here. So table of uses is something that a lot of zoning people talk about, a table of uses, and it's pretty boring for other people, but what it does is it sets out where certain uses are allowed in the town and their zoning districts. And so I highlighted a couple questions about whether certain uses are actually desirable in certain locations. And so I detail that in the memo. I think the best example is whether an indoor cultivation facility is suitable in the highway business, for example. And it's usually, seems like they're resulting in metal prefabbed buildings, and so whether that would be appropriate in the highway business. So those types of questions. And similarly, there's a question just generally about retail occurring in industrial districts. But there is quite a model for that with medical marijuana. A lot of towns kind of put them initially in industrial districts and allow the retail to occur there. And that may be less of an issue. Sorry, I'm going to reread my memo here. I think that the downtown business and neighborhood business may have had opportunities for research facility and testing labs, and the question is really whether in the downtown business district would you want to have those facilities built, or maybe occupying existing buildings would be an opportunity, but to have a new structure built solely for that purpose in the downtown business district was a question. This is on page 2. There was, I identified an opportunity to separate a cannabis retailer from on-site consumption in terms of the table of uses. They were sort of merged together, and there's useful aspects to that, which would be for voting purposes, whereas if social consumption were a complicated vote that was going to be problematic at the next stage, then it could be voted separately. And then just in terms of zoning uses, to consider them the same for zoning uses was worth looking at, discussing. And if you took a cue from the state regulations, they talked a lot about package stores as one reference point with alcohol, and then the on-site consumption is more akin to bars or on-site consumption for alcohol, and they are treated differently. They're licensed differently. You look at different criteria. The licensing for a bar is a little bit more strict, and people are much more aware of what's happening on the premises at, in a bar than a package store. So just calling out the potential differences between those two. Something that I'm particularly interested in, I'll be working with the planning board when they receive any future application. So I highlighted a couple of key application requirements that I thought should be put on the table. Without getting too much into the nuts and bolts of how the Cannabis Control Commission license process is going to work, the general approach that a lot of towns are taking is to require an applicant to have applied to the Cannabis Control Commission, and they will determine that the application's complete, that it has all the technical requirements that they're looking for, and then so they would have to submit to the CCC before they come to the planning board. If the planning board were subject to a lot of applicants, that would help make sure that the planning board has all that information that was submitted to the CCC. So that's kind of the first application
Jeff,
point.
there was some confusion at our last meeting exactly about how the process was and sort of the chicken or the egg kind of scenario. Can you maybe get into the nuts and bolts a little bit on that part about how that process is under the draft regs anyway?
Yes.
You're stating the application has to be sent in, not the results of the application.
Well, there's another section, so I'll lump them together. So it's creating a box in which the application is heard with the local planning board. So the application should be submitted, this is the recommendation, the application should be submitted to the CCC, and then it would allow the planning board to start their public hearing process. And then to what Mr. Zarvis was saying is, before the planning board issues the final special permit, the CCC, the Cannabis Control Commission, should have issued their license first. It gives, in theory, it gives the planning board the most protection in approving a special permit, to know that an applicant has successfully finished all the state's requirements.
I don't understand that. You're saying that they have to have succeeded, not just put in the application, but succeeded in getting the application from the CCC approved.
Correct.
But the CCC states, as part of their process, that checking in the application that they've complied with all zoning.
Right.
So you just can't do that.
No, and so I have had the lucky experience to host a recent session with a member of the Cannabis Control Commission and an attorney from KP Law and a town planner in Central Mass. And what the discussion was, similar to the medical marijuana process, what applicants were required to do is submit a letter that says that they are in compliance with local zoning. But what the CCC's, from what the regulations say and what's understood, is that the CCC is looking for a statement from the municipality that an application could go forward. So it's not that a special permit must be granted. It's looking for specifically that the location's not within any buffer zones. So the state has their own 500-foot buffer if the town has none. That a special permit or site plan review is an opportunity in that location.
Okay.
So in the medical marijuana process, there was a simple certification that an application could be submitted to the town, not that it has to be completed. So I think the connection, the important thing is, once the Cannabis Control Commission deems an application complete, they have 90 days to issue their license. So that's 3 months. So and then when the application's complete, sorry, I wanted to have a PowerPoint for this and I didn't have time. And I can see this is going to take some time to sort out. Once an application is complete with the CCC, they notify the town that an application has been submitted. The town has 60 days to say that the location is suitable. And then the Cannabis Control Commission has 90 days to issue the license. So 3 months is the CCC process. So they would render their decision and grant the license within that time frame. I can go over that again. That's definitely
Well, understanding it, it just seems really tight, and it seems like we're putting a clause in that could, because as you said, they're in discussion about these things, that could backfire and be a problem for us. I love the idea of having the security of people coming to us well put together. That's always a benefit to the board. But I hate the idea that we've just really messed things up by putting this in before it's even ironed out. It seems like it's an unsafe thing to add.
Yeah, I think that where this entire process is right now is right before the state issues their final regulations. So they're set to issue them on March 15th. So there is an opportunity for that to be something added at the city council level during that process, but I would be more articulate, but I would also request the same thing at that point. So on that particular issue, the recommendation would be that the CCC issue their license before the planning board issues a special permit.
Thank you.
This is not going to get done in 10 minutes. I'll skip some of them. There are some basic things that are pulled from the existing Easthampton zoning ordinance that would make sense to have in here. So traffic impact statement clearly identified as a requirement. And there is an existing provision for many uses in Easthampton to require that same thing, so it's kind of belts and suspenders. There's some language in here that could ask the applicant to submit the information used to state where they are within reference to a buffer. So whatever that distance is, if it's 200 feet, 350 feet, or 500 feet, the applicant should show what they used to show that they are outside of that buffer. It's pretty common evidence to be submitted. One thing, again, I have a long list to put items on the table for discussion, regardless of what the board identify for the buffer. One recommendation would be for notice to go out to all or certain uses within 500 feet. So if you, I know there was some discussion of the liquor license process, and what that liquor license process is that for any application, notice is given to any schools, churches, or daycares within 500 feet. And so that's notice of the public to be notified and can come and talk. So regardless of the buffer distance, the board could, without being overly restrictive, require that they be notified at a minimum. The recommended findings, again, that's the licensing from the state, which we can go over again. I think it was incorporated that a host community agreement shall be in place before the planning board issues a permit. There is just a little bit more, and it may not be necessary, the line queue plan for people potentially waiting outside. I think that's been incorporated. There's a catch-all. This is item number 5 for marijuana establishment operations shall not create a nuisance condition, and it lists a bunch of things that would be available to the planning board to consider in their process. So disturbances of the peace, open public consumption, excessive pedestrian or vehicular traffic. These are the unknowns about the demand, so it gives the planning board opportunity to make sure that you could address any potential concerns during your hearing process. Just again tying in other provisions of the existing zoning ordinance. So you have a whole special permit section which requires the planning board to make findings for a special permit, and just making sure that that's really clear to applicants that there's other requirements as well. Some of the more policy related questions is the number of establishments, so the number of retail establishments in particular. I'll save that for when it will come up. I'm sure it will come up separately. I think actually regarding that, it would be important at some point this evening to discuss the state regulations talked about 20%. So if you have package store licenses, you have a certain number issued in the town, and the state regulations use 20% of that as a benchmark for communities to start limiting the number. So just for reference, I think based on information I was able to get today, the city has either 8 or 9 off-premise licenses. I think the number's 8, but I wanted to have a little bit more time to check. If you use 9 as the number of package store licenses and have 20% of that, that's 2. And so what the state regulations say is that that's the most you can limit it without going to the ballot. But communities can limit 50%. So 50% would be 5. The proposal was at 12 or 14, so I think that would be clarified. But just knowing that you are exceeding that threshold with the numbers that you're talking about. So I think it's based on the off-premise licenses, not the total licenses granted in the town. There are a lot of other sections of the bylaw that would make sense to have reference, and I think that made it into the most recent version. A policy question about separation between establishments. So generally what is sometimes of greatest concern is the number of retail establishments close together. So in other states, there has been some cases where they get put in very close proximity. And so what my memorandum seeks to say is that for retail establishments, that should be potentially where you think about a buffer between two or more establishments, as opposed to cultivation or manufacturing or product testing, which if you envision them going out in an industrial district and are in a metal warehouse building, then it's much less of a concern to have two metal buildings in an industrial district that are growing cannabis. So the separation in the industrial district doesn't make as much sense necessarily, or there's less of a need to separate them out there when they're not retail. This is getting close. I had raised a question about the typical path of travel, just that it would be good to clarify whether you're a pedestrian traveling on sidewalks or a vehicle traveling on the road. So in the highway business district, you may not really get a walking travel path as easily as in the downtown area. I had written in the memo a question about waivers, and I know there was some discussion last time. The Cannabis Control Commission can issue waivers under certain criteria. I think the discussion was good in terms of that could be challenging to issue a waiver, especially on something like the buffer. So you may be able to identify certain sections of your bylaw that are eligible for a waiver and apply it only to that. So you don't have to apply it carte blanche that anyone could get any waiver. You could identify a couple of the key things that might be suitable for waivers. So maybe you would say, we're not going to waiver the number of establishments, and we're not going to waiver the buffer. But if there's a parking requirement or some other provision that you would deem suitable for a waiver, you could apply it to individual sections. I'm sure I missed something, but I think having maybe Councilor Derby go over where you are at with the regulations would make some sense.
Can I just say thank you first? I thought this information was very helpful.
Thanks,
Yeah,
Jeff.
thanks. And since you wrote that, there had been another iteration.
Okay.
And since that, I've incorporated some of your suggestions.
Okay, perfect.
as
So
well.
that was what I wasn't aware of, so I appreciate that.
And so I'll just start basically where where you started, which was specific businesses in specific zones. For example, cultivation and highway business. One of the things that is a little difficult, and the reason why I didn't change the table of uses on that particular piece was because in highway business we have a variety of different businesses, and if someone was going to put a cultivation space, it's highly unlikely, especially once they go through the special permit process, I would imagine it would be highly unlikely they would erect a prefab metal building on Route 10 just because of the price of per square foot and the use of that. But if you look at where Cook's Building Supplies is, that's still in highway business, and that could be a potential interesting reuse of that property. So if we exclude specific types of businesses from specific zones, we're not necessarily looking at those zones as the complicated areas that they are. I don't know if that makes sense. But so that was one of the things that I didn't touch yet. But I'll go through and talk about the things that I did. For example, we do have a no retail storefront or adult social consumption business of the same type shall be located within blank of another business. And I do like the idea of excluding the mill industrial piece from that, just because it is such a interesting area. But that is something that we did include, and we also measured it as by a typical path of travel door to door.
Okay.
So it would be the front door of the establishment.
That's pedestrian travel.
For pedestrian travel in that area. We within highway business, it would still be door to door. So I think that's something to think about. I did add in section 10 point, it should be 10.7, but it says 10.6. A community host agreement. No special permit shall be granted without first having executed a host community agreement with the city of Easthampton, which was one of your recommendations. The next one was a license requirement, and so I'll just go over this real briefly. because this one can be a little bit confusing. So the applicant shall submit proof that the application to the Cannabis Control Commission has been deemed complete pursuant to 935 CMR 500-.102. Copies of the complete application to the extent legally allowed shall be provided as an integral component of the application to the planning board. And then the second piece of that is, and it might need to be its own section, but since it's under license requirement, that nobody can operate a cannabis establishment without having a license in good standing from the CCC. And I think that this part, what I read from it was that they have submitted a complete application, not that it's been approved, and that complete application could be given to the planning board to show that they have gone through the steps that they needed to go through. But that was just my understanding of it. I don't know if you read it differently, but
No, I think that definitely covers the first part of my initial recommendation. I don't know if now is the time that you would want to discuss in a little bit more detail the findings part. So that would get an applicant to the planning board, which makes perfect sense, and so that's good. The secondary part is when the planning board makes findings, it's really findings of fact that they use to support their decision in granting the special permit. And because of the potentially unique nature of some of these businesses, it would just give the planning board additional facts and protection to say before they grant a special permit that they have met all of the CCC requirements and the CCC has issued their provisional license, and therefore, based on that, we issue our special permit. It's something that we can continue to discuss. I know there's a lot of people in the room,
Right.
and I don't want to belabor it, but I would still try to offer that as a recommendation, really intended to help support the planning board. There could be multiple applications, and at some point there may be a need to say whether it's the location or if there's abutters or if there are people who may not support the project. They would give the planning board an opportunity to say the CCC found everything in line, and based on that finding by them issuing the license, we will also grant our special permit. I'll stop after this. I think a lot of people have referenced the regulations as being very lengthy, 107 pages. There are many things in the regulations that could help protect the city when these uses come forward, and having that license granted would be useful. The medical marijuana guidelines, which I would have liked to prepare a PowerPoint to show some of these things, but the medical marijuana municipal guidelines clearly state that a municipality can issue a special permit without the license, but need not. And so the towns can wait for the state to act first and then issue their local special permit. So I think it's worth discussing possibly a little bit later.
Okay. Sounds good. So the other piece that was inserted, this was in the planning board's original draft. It was a formatting omission. The line Q plan is back. A new section is traffic impact statement. So that was directly taken from the memo. Parking, and this is where we identified that in table 10.3 off-street parking regulations and section 10.1 off-street parking and loading requirements shall apply to recreational cannabis businesses. It would also have to be amended in the table of uses. And then permitting, the planning board shall be the special permit granting authority. The application requirements and procedures shall be conducted pursuant to section 12.7, special permits of the zoning ordinance. And then the final piece that has changed is basically the adaptation of the waiver process from the state regs, which basically allows the planning board to waive applicability of one or more of the requirements imposed. The applicant shall be required to submit the request in writing and identify whether the waiver is in the form of a provision of the state law or local law. Any waivers from the state law should only be granted if said waiver was also approved by the Cannabis Control Commission. So this is kind of like a double step. So if they had applied to the state for a waiver, then we also have the ability to grant or deny that a waiver locally. I believe that's the way it works.
Yeah, I think that would be great, yeah.
And that's really, those are the main changes since we got our new planner's memo.
There also is a cap written in here, but we haven't put a number yet on the cap, so we can discuss that tonight.
Yes.
So we did incorporate that from the last meeting.
Oh, true.
And
I was just going through the things
Oh,
that-
I'm sorry.
from the planner, but that's,
All right.
that's no problem.
Sorry.
I don't know if we want to, that's, I feel like getting down into the nitty gritty. Do you want to?
Well, we can wait and do that when we're deliberating.
Yeah.
We can do that. That's
Okay.
fine.
Could I just ask, so I have some knowledge of the process from here. Would you think that this is a good opportunity to remind people of where we are in the process, what happens after tonight and what happens next? Because I think that that is important to understand that this is not the final vote per
This
se.
is not the final
Okay.
vote.
Yeah.
So, so after tonight, we'll do some deliberation, decide if we're in the right place, to whether the planning board decides to make a recommendation to the full council. When generally the ordinance waits for the planning board's recommendation, and then we bring it forward to the full council where we'll have a public hearing, and the ordinance would have to pass by a 2/3 majority of the city council.
And that would happen in the near future.
In the
That
near
was
future.
the idea.
Yep.
Okay.
To prepare ourselves. April 1st is when the CCC is going to start accepting licenses or applications. They're not going to grant any licenses right away, but having zoning in place for April 1st does make sense.
Yes. And so the one thing that, if I could add to that, is that, again, the state is expected to issue their final regulations on March 15th, by March 15th. It could happen sooner. And they're having policy debates today, tomorrow, and Wednesday. So I just wanted to, I guess, state that between now and a public hearing with the full city council, there could be a need to at least identify changes in the state regulations that may need to be addressed at that hearing. So that was something I'm very in tune with, understanding and watching just how much of the process that we know from the draft, it may change in the next couple of weeks. And so far, if they've already eliminated some of the license types, then there could be other changes that we need to follow in preparation for that whenever the hearing is in March. So, okay, thanks.
Thanks.
All right. Thanks, Jeff. Okay, so I guess we got a couple submitted statements. Owen, you want to read yours first, and then I can read the ones that I got?
And then
Council
comment.
comment
And then we
go?
can have- yeah.
Sure. So give me 1 second here to open up my email again. So the first one is actually one of a few, but this is just basically a summary from, sorry. Okay, this is from a Joanne O'Leary, who submitted a few, but this is basically a summary of kind of the piecemeal submissions she's emailed to the Ordinance Subcommittee. I'll read. I will read this in total. This is the City Council, Ordinance Committee, and Planning Board. I think most of those who voted yes on legalizing retail cannabis expect careful, considered change that will be best for our community. I agree with many. It's wise to start with a small number, location, and type of license while we learn from the experience of other places. Retail cannabis is new to our state, to much of the population, and to some aspects new to our country. Denver just recently accepted the first in the country application for a coffee shop allowing social consumption, part of a 2-year pilot program. Thank you for considering the following in our cannabis ordinance. 1, reduce the number of licenses to 2 to 3 to start. Keep the 500-foot buffer as proposed by Massachusetts. Mass General Law requires a 500-foot buffer for alcohol. There's research behind the alcohol buffer and effects on youth. Where's the research that says this will not matter with cannabis? Denver, Colorado, with years of experience, 1,000-foot buffer. Perception is a real issue. Public and private school teachers, among others, have real concerns on this issue. Union Street and Cottage Street are cultural district. Having a number of vacant storefronts, we need to encourage a diversity of businesses that reflect the culture of our community. The National Institute of Health also considers perception of the safety of cannabis an issue for our youth. No social consumption or mixed use. Wait and gather evidence and learn from the experience of other communities. Listen to state district attorneys. Immediately allowing marijuana in restaurant, coffee shops, theater spas, and yoga studios is irresponsible, ill-informed, and dangerous. This is from the Norfolk County District Attorney Michael Morrissey, President of the Massachusetts District Attorneys Association. Density of businesses greater than 50 feet apart, see perception above. Education, require education certification for serving, selling staff. Are there certification programs in place? Programs, resources for youth, schools, parents, law enforcement, health and safety organizations, educational materials given with cannabis purchases. Additional issues, I hope these will be addressed by the state. If not, please include, since marijuana is not regulated like alcohol and takes out many of the industry and public health safeguards, ensure maximum local control, require opt-in for social consumption, empower law enforcement, boards of health, and their agents to conduct local compliance checks for underage sales, over-service public smoking use, and abiding by any other state and local laws and regulations, and give local authorities the ability and funding to issue penalties for noncompliance, continue special permitting to enable a community to apply penalties for noncompliance at the local level, maintain the requirements for mandated host agreements and community outreach, age restrictions, maintain 21 over entry to all types of establishments, mixed use, no separate rooms, must be separated, separate entrance and ID checked at the door. 3, follow clean air state and municipal regulations, re-smoking and vaping, identify a system by which local communities can effectively enforce no public smoking, the right to ask for ID for noncompliance, the right to issue fines, and a statewide system for collecting the fines. And then there's one more we just received just prior to the meeting, and this is from a Matt. His last name is spelled W-A-U-G-H, so as we know from a Dr. Seuss book, there's multiple ways to pronounce that, so it's either wah or wuff. Wah. Wah? Wah, thank you. All right, so this is from a Matt Wah. Dear City Council, I'm a local business owner serving numerous and other small businesses and individuals. I want to add my 2 cents to the cannabis zoning conversation. I wholeheartedly agree with the statements and sentiments below. Please consider incorporating them into your final regulations. Thank you for your time. Sincerely, Matt Wah. Move forward in a Fort Worth manner that is business friendly because our city will benefit being an early adopter of legalization of cannabis tourism. An influx of people downtown will financially benefit all Easthampton businesses, such as our artists, ice cream shop, bookstore, bakery, grocery stores, gas stations, restaurants, and farmers market. Organizations like the Chamber of Commerce and the ECA have been working hard at bringing people to downtown Easthampton as they know the positive impacts it has for the whole town. Additional revenue via new tax-paying businesses will help fund city projects such as the new school, making our town more economically stable. It will financially benefit all Easthampton residents. It will establish us as a community that welcomes all our residents and encourages visitors. It will enhance the artistic feel and reputation that Easthampton has been cultivating, no pun intended. That's my. Do not limit the number of licenses issued. If there needs to be a cap, return to the original plan of 12 licenses per year because as a community, we want to hear from creative entrepreneurs, not lose them due to a manufactured shortage of licenses and other barriers. Easthampton doesn't have to issue all of the licenses, but we should have the flexibility to move when opportunities beneficial to our city arise. We need enough licenses to support a diversity of businesses. There needs to be room for small organizations from getting a license as well as larger organizations like INSA. Small businesses such as yoga or dance studios, massage clinics, herbal schools may get shut out if the licenses are too limited. None of these businesses are turnkey and will likely take more than a year before they open. Remove buffer limitations or implement a more reasonable 200-foot buffer because Northampton has voted for a 200-foot buffer, which is less challenging to a new business and more appropriate for a small city. We want to attract businesses and tax revenue here, not to lose it to the next town over. There are very limited spaces available if the building cannot contain any residential units. Each businesses will also needs such as parking spaces and other services. Real estate options should be as diverse as possible, start with, and limited as needed. There should be enough real estate selection that businesses can find floor plans workable with their business. Buffers are not an appropriate way of keeping people under 21 from cannabis. Other measures already reflected in the ordinance are effective, such as identification requirements, good filtration systems, and the fact that legalization and regulation for adult is in itself a deterrent. Buffers are unnecessarily discriminatory as people who enjoy cannabis are not a threat and do not need to be hidden away. And this is again from Matt Wah. And that's all I have received.
All right, thank you, Owen. Well, fortunately, one of mine was one that you already read, so I only have one and it's short. So this is an email from Ethel S. White at 44 Huckleberry Lane. She says, to Easthampton leaders, as a resident of Easthampton and a voter, I am distressed by the number of licenses planned for retail sales of marijuana. Such a small town does not need more than 2. I fear Easthampton will become a Potterville of pot shops, bars, and tattoo parlors. Do we really want such a population? Deserves better. I understand the lure of taxes. However, Easthampton needs to put a greater effort into bringing classic retail into the downtown area. I have seen it work in other places, and shops here like the Big E, the Big Red Frame, and Small Oven are doing very well. Please rethink what is best for Easthampton. It has such potential. Peg, you want to make a statement now?
Let me move this. So, good evening, everyone. Thank you for attending. For those of you who don't know me, I'm Peg Conniff. I am not a parent, unless you consider dogs, and then I'm pretty sure they would not consider me Mother of the Year material. But I do have a lot of nieces and nephews, and even a few great nieces and nephews, so I do have a perspective and a point of view when it comes to the safety of children. As I've listened to the conversation over the past several months, I can say that I have learned a great deal about cannabis, perhaps more than I ever imagined I would ever want or need to know. I understand the perspective of those who argue that we must keep children safe. We must do everything we can to ensure their protection. I agree completely, 100%. But within the context of this discussion, one would have to first convince me that what we are doing up here, what the Commission is doing in regards to recreational cannabis regulation, is creating an unsafe environment, and I just don't see it. I understand that those in the educational field must always put children first and always take a stand as their advocate. I appreciate their perspective, and I applaud it. But for those of us sitting up here, our lens must be wider. We need to consider all of the people impacted and do what is best for all. For the business community who is looking to establish new and creative opportunities to bring more foot traffic and interest to all of the downtown area, including employment opportunities. For the city in realizing new revenue streams. For the voters who overwhelmingly supported the legalization of recreational cannabis, and even for those who voted against it. They all get a voice. Some will certainly be louder than others, but from my perspective, they all must be heard. There will not be one solution that everyone will agree with, but as Councillor Derby has said, we must create an ordinance that is equitable. Should we move slowly on allocating the number of licenses in the first year? I think that's a fair and equitable request, and one that the Ordinance Committee agrees with. We crafted wording to limit the number to 8, but I'm open to relooking at this point and further discussions on limiting the number of total establishments in year 1. There is a call to keep the buffer around schools to 500 feet. The original proposal was 200 feet, and a compromise to that was made to 350 feet. To be completely transparent, I don't see any need for a buffer. The arguments fall short of convincing me that any buffer will create a safer environment than no buffer at all. I don't see these establishments as inherently unsafe, so trying to convince me that a buffer makes them safer just doesn't work. There will be no access allowed to anyone under 21, and something we can't say for all of the retail stores that sell alcohol. I think a buffer of any size restricts options for business ventures. It also leaves us with the potential to cluster cannabis locations in a smaller area, even with the disclaimer that they must be a certain distance from one another. I admit that I'm confused about how a storefront with no signage, no visibility to the inside, and no access allowed unless you show proof of your age, which will be limited to 21 and over, can be construed as unsafe. I'm left to conclude that it is not the location of the shop, but what cannabis conveys that falls under the heading of unsafe. Further, I am more concerned about having cannabis in the home and consuming it there, which is why I also support cannabis cafes, which may be a moot point now that they've taken it out of the regs. I felt it was important that you know where I stand and how I think about these issues. I'm interested in hearing from residents who did not vote for this to better understand their concerns, and I also want to hear from the business owners who would be sharing a street or a building with these shops and cafes. I thank you all for your attendance and for your interest, but most of all for your involvement. Thank you.
Great, thank you. So as I said, I'm going to wrap up the list that we had last meeting, and then I think we'll just call on people. Again, if we can have people who haven't already spoken, so everyone gets a chance, try to keep the comments brief and try to get to the merits of the actual draft bylaws and ordinances that we're doing here. That would be really helpful
Can
for
I
us.
ask a question first?
Yes.
Do we have the map that we talked about last meeting?
Curious about that as well.
Yes.
Do we?
Yeah.
Can we throw that up there? That might be helpful.
So I've made 3 maps that show potential buffers at 200 feet, 350 feet, and 500 feet. The areas outlined in black are the zones that the most recent proposal allows the cannabis in. I'm going to zoom in so we can see, focusing on the downtown.
And this is done using the property lines, not door to door, right?
This is a
Okay.
200-foot buffer. So this is showing a 200-foot buffer around K through 12 schools in the downtown. So we have Maple Street, Center and Pepin, and Williston, Northampton. This is a map showing the 350. And this shows 500.
And this also is using, so like for the Williston property, you're using any property owned by Williston? Is that how it's done? Okay.
And is the regulation that there cannot be a cannabis establishment in a building where there is a residential establishment as well? Is that what I'm
The
hearing?
most recent proposal
Yeah,
that
that
Salem
was an
Distributed
omission,
showed.
actually, last time. It was supposed to be except in mill industrial or downtown business.
So it's
Except
no
in
longer
mill
in
industrial and
So,
downtown
so if you
business.
look at it now, you'll see that that is waived for downtown business.
Okay.
Okay. So if it was at 500, then Main Street is, some of Main Street is allowed, none of Union and like 1 or 2 buildings in Cottage.
1010-4B.
Can I just make a comment about, I think that the map is extremely useful, except that, and I give Jamie a lot of credit for working on it between the meetings. There is an important task to still look at door to door. The state regulation, so it's not abundantly clear or easy to find. It took me going back to the medical marijuana provisions that the state has issued, the Department of Public Health, and where they have municipal guidance document that came out in 2015, and what it says is that they measure it from building to building. So I think as a reference point, the door-to-door is good. Building to building would also be pretty close to what you're trying to look at. The maps are still not there. I think between now and a public hearing with the city council, I think those maps could be produced. But I think for the time being, it's really important to just note that the draft before the committee tonight says door-to-door measurements, and it's actually path of travel.
Right.
So you have to really take that into account when you're looking at these maps. So I think refining this still is important. How the planning board votes tonight, maybe a discussion point. But to know that the maps could be, I think, clarified with a little more time to show path of travel or building-to-building measurements.
So I'd say this is 500.
Yep.
I'd say this is relatively, as having measured door to door with a wheel, it's pretty close.
And it's too much.
And so it would basically, it looks like that goes to the street, which is right next, kind of across from Brass Cat.
Yep.
And that, if you measure 500 feet or with the wheel, it gives you about 1, 2, 3, 4 more properties as you look at those property lines there.
Right, and I guess I know that the Williston has been at all of these hearings. I think if you look at a Williston property, for example, sometimes there are either unused or underutilized or not buildings, occupied buildings, and that's where the measurement would be much more important to see.
Well, sorry.
Yeah.
Just to point out, this, I believe, is Tandem Bagel property, or I think right there on the. So that's owned by Williston. It's obviously not used for the educational facility. I don't know how, with regard to Williston, how to sort out the difference between a dorm and a classroom. I don't have that level of detail.
Or faculty housing.
Yeah, so.
Right. And especially considering that it can change.
Or administrative buildings too.
Well, that's a good reference for our
Okay.
discussion.
Okay, thank you.
Okay, so then I will start with this list from the last meeting, and we'll see who wanted to come back. Marty Klein?
Yeah. I'll work with you on that. I think we can handle that.
I know a thing or two about working uncounted volunteer hours on behalf of the public good. And I want to thank you for your diligent work and thoughtfulness on this issue. I brought a picture tonight because I can't remember that we've actually seen the object in question at these hearings, and so I brought along one of my pictures, and I'd like to just pass it along the board, and I'd be curious to see if it evokes any kind of feelings of fear or other negative feelings, and just try to imagine a picture like this with a little sign underneath it that said, Easthampton grown, and think of what kind of threat that would be. Funny thing, legalization is looking more and more like prohibition. Correct me if I'm wrong, but my understanding is that you are tasked with creating laws to protect the public health and safety based on provable evidence of harm. Since social consumption is off the table, let's talk about buffers. I'm actually not anti-buffer. My favorite kind? The one that's used to polish floors. My second favorite buffer is a planing tool. The state says no development in a 200-foot buffer zone along rivers. Why? Because it's a proven fact that disturbing this area has negative impacts on the ecosystem there. No argument. Accepted and fact-based law. Now let's think about the kind of buffer being discussed here. Personally, I believe that kind is frankly a joke, an unfunny one, based on unsubstantiated fears and magical thinking. Initially, a 200-foot buffer between cannabis shops and schools was proposed. Then that was compromised to 350 feet, which was 150 feet short of what the other side wanted, though I heard 2,000 feet tossed around at the last meeting also. Over the many months of these meetings that I've attended, I've yet to hear a shred of evidence why that extra 150 or 300 feet makes a difference beyond something that's called perception. Well, here's my perception of the message that buffer sends, that what we're shielding is harmful, so harmful that crossing that magical line will cause unspecified but apparently serious harm to young people. Almost as if someone wants to site a nuclear waste dump on Union Street to me. That might be easier to put in. Oh wait, it's just a flower shop, you say. We actually have a perfect test case in the city, Center School. If this perception demon is real, then there should be a mountain of evidence showing that kids who go to Center School have much higher rates of alcoholism and lung cancer than kids that go to other schools. They are less than 200 feet, there is less than 200 feet proximity to drinking alcohol at the Pass Comic Club and retail alcohol and tobacco sales at 2 adjacent stores. Have you heard any of that evidence? Statistical facts? No? Why? Because there isn't any. I'm reviving a slogan from the Reagan campaign, I can't believe I'm saying this, of the 70s. Where's the beef? If legalization, as the other side asserts, means kids under 21 will have more access to cannabis, show us the evidence. I would assume that if what they are telling us is true, in the years since cannabis, recreational, and medical has been legal in Massachusetts, there should be lots of stories about kids getting their hands on their parents' stash. I read the news pretty carefully. Did I miss that? The fact is that kids have as much access to cannabis as they want, whether from growing it or other black market means. Having shops in town is not going to affect that. Should we erect stalks on the Rotary and put parents there who are careless with their weed to shame them in public? Unfortunately, we cannot legislate parental responsibility. The more we treat something as bad, forbidden, the more desirable it becomes. Imagine if instead cannabis was treated as the benign substance it is. My guess is that the appeal of the forbidden would be lessened. Slow down and we'll revisit things in a year. Sorry, folks, but I don't trust that. Let's let the market decide how many shops are appropriate here. Honestly, I would be more inclined to go along with some of what the other side is proposing if they had a better record of protecting our youth from the scourges of alcohol, tobacco, and opioids, which they don't. History tells us that the winner gets to make the rules and the others have to live with it. The sky is not going to fall on July 1st. Thank you for giving me the opportunity to speak tonight.
Looks like Roger Herman. No? I might be reading that wrong. It's 11 Cranberry Lane. Oh. Ethel White.
You read
I
her.
did read her email, that's right. Kim O'Leary. All right. Greg Rowland.
Thank you. Greg Rowland, 23 Summer Street. Good to see you again. Thanks for the opportunity to speak this evening. I didn't get a chance to congratulate you, Owen, being a new city council member. Welcome, Jeff. Welcome as city planner. I'm an Easthampton resident, youth sports coach, father of 3 kids that are approaching adolescence. I'm married to a school nurse who works daily with teenagers around their physical and mental health, including healthy relationships and sexuality, nutrition, taking their legal meds correctly, avoiding illegal meds, and risky behaviors in general. I'd like to talk about buffer zones. The standard boundary for safe school and drug-free school zones is federally set at 1,000 feet. In the marijuana states, Colorado, Maine, Oregon, Washington, Nevada, all kept the zone at 1,000 feet. One could wonder, has access been a problem in Colorado? Has their market been withering? Not at all. With the 1,000-foot buffer, the market is thriving, as it would here at that level. Massachusetts law ignored the federal standard and made it half, 500 feet from where children congregate. Do you know none of the states concluded or even argued that buffer zones are meaningless, however? They all agreed that some significant buffer zone makes sense because it's responsible, and most parents, educators, and youth workers agree that proximity for kids matters. Proximity is not just an access issue. It's a messaging issue. Most parents do not want their kids walking out from school and seeing alcohol and drug retail locations or activity, licensed and legal or not, there or on the way home. Whatever the adult-only activity is, gambling venues, strip clubs, bars, liquor stores, smoke shops, gun dealers. Many don't want their kids walking by a lot of these locations. Why? Hypersensitivity? No, it's because of the influence and the message. It says something to kids when we decide to zone a pot shop next to an ice cream and candy store, or a school, or a playground. On the issue of buffer zones, it should be enough to understand that there are hazards for kids and adhere to the state's legal guidance on this of 500 feet. If not, then it should be enough once you've heard from the school committee, the superintendent, youth workers, addiction counselors, therapists, teachers, numerous parents, and the city's largest private employer, or one of, Williston Northampton. It should be enough to hear, understand, and respect how widespread and deep the concern is on this issue. I urge the committee not to go lower than the state's legal guidance of 500 feet. A recent study on buffer zones was released 3 months ago, in November, by researchers at the University of Virginia. I have it here. It's published in the International Nursing Review. There are 9 copies here, so for Jeff and the 8 members. Researchers studied licensed tobacco retailers placed in the vicinity of schools in South Korea, where smoking rates are exceptionally high. And UVA researchers asked what were the factors associated with adolescent use outcomes. They found that, quote, the factors that influenced receptivity to tobacco marketing included the presence of peers who smoke and the frequencies of licensed tobacco retailers that they passed on the way to school. The factors that influenced lifetime smoking included the presence of siblings or peers who smoke and the frequencies of licensed tobacco retailers passed on the way to school. So if a child regularly passes a store, they are more vulnerable to advertising and more likely to become regular users. If a child passes more stores, the likelihood increases. Buffer zones matter. And the number and frequency of retailers matters. It's not a magical effect. The study concludes that there is, quote, a need for zoning and licensing regulations to restrict licensed retailers in areas that adolescents frequent, including schools. For many parents, this is already common sense. The legal guidelines in Massachusetts and Colorado suggest it. Your school committee requested it, so please help. Please respect the state guideline of 500 feet. These buffer zones matter. Most parents know this, and guess what? They're coming to you because they know. And evidence like this shows that regular drug use is not something parents can police alone. Peers and siblings have a major influence. The presence of other users has a major influence. And the number and frequency of proximate retailers has a major influence. So when I heard this board last meeting say what is needed more around this issue is for parents to be parents, I didn't find that to be at all reassuring as a solution. Most families are struggling hard to raise their kids and steer them away from life's hazards. It is not a stretch to keep to 500 feet. Look, kids are paying attention to what adults are signaling. If adult leaders and elected officials are sending thoughts and prayers, but aren't taking concrete actions to protect them, they know. They think it's a shameful joke. If there are more for-profit pot shops in town than there are gas stations, that will register. It will register as a priority and as reckless. There should not be more pot shops than gas stations. Access is not impeded. Lastly, I plead with you to not chart a path that makes Easthampton an extreme outlier. Voters did not ask for Easthampton to become a hub of marijuana sales and consumption, a version of Atlantic City. That's not what the vote meant, and it's a massive misinterpretation of ballot results. How do I conclude that? Well, here's what other similar communities have done, ones just like us, medium-sized ones that all passed Proposition 4 at levels over, which are comparable to us at 62%. They have all been consistent in their ordinance language with Mass General Law's definitions and with the CCC proposed regs, which use the term marijuana in its definitions 17 times, and cannabis, none. For legal consistency, please use the same language that the state and all our neighboring communities across the Commonwealth use. None of our peers, and remember, these are communities that passed Proposition 4 at levels above 60%. None have departed from the state's legal guidance on 500 feet buffers. All of our peers, if they have a plan, have put forward a retail cap and not left things open-ended. Let's make a clear cap on licenses. All of our peers that have proposed or passed a cap have done so at rates from about 1 per 5,000 to 1 per 12,000 residents, not 1 per 1,000 or 1,000 and change. We are an extreme outlier here. And none have started at one level, in our case 12 licenses, and then after hearing community concerns about that level, came back with a higher number, 14 to 16, and called that compromise. To my knowledge, none of our peers have planning boards that employed reasoning that proximity to schools doesn't matter or doesn't have an effect at all, or refused to seek legal opinion from the city's attorney or state legal experts, or combated and overrode their own city planner's informed opinion on some issues, or took it on faith that voters who voted to decriminalize possession of a small amount of weed really meant that they wanted for-profit pot shops in downtown, or THC as an ingredient in foods, or pot home delivery. It's just not true. But such is the case here in Easthampton. Taken as a whole, it is a pattern of unusual behavior, and while I laud sincere efforts at compromise, I don't appreciate staking out an extreme position, then making it a bit less extreme and calling that good enough. It's not. I'm not a prohibitionist, believe it or not. From the beginning, I've been asking for moderation, and that's just not what we're getting with this plan. I urge every joint committee member who has reservations about the plan to listen to those reservations before you put your name behind a plan that steers us on a path to becoming an extreme outlier in the state of Massachusetts, even amongst comparable communities who voted like we did. The residents of Easthampton deserve the wisdom of a moderate approach, so please take one. Thank you.
Thank you.
Thanks, Greg. Mike Cutler?
I think Dick Evans might be representing him tonight. They're partners.
No? Okay. All right, so at this point, I'll open it up. Yeah?
I had received a phone call and email from a constituent who wanted to be on the list, but they were not aware of it last week.
Okay.
That's Russell Brand. Would he be able to?
Sure, we can start with Russell Brand.
I was on the list last week. I didn't hear my name.
What's your name?
Person two.
What was your name?
Mine is Christine Brain, PTO.
It's not on the list. There's also an attendance list that's been circulating. There was an attendance list last week as well, so it may have been signed up on the wrong list. I'm going to open it up here to the public as well, but this is one of the reasons why there was a problem with the list last time, is I think getting access to the list, and hopefully this will clarify some of that. Is Russell Brand here?
Russell's there. I think it's Russell. It's not Russell Brand.
Oh, it's not. Oh, Brand. Well, he can correct us on the pronunciation.
So excited.
I hope my sister gets a chance to talk because she spent some time making some good words. My name's Russell Brain. I'm a longtime resident of Park Hill in Easthampton. I have some things I wrote, but as far as the buffer zones out west, I've been to Colorado, I've been to Washington. They're very spread out, and clearly the reason Massachusetts is somewhat less is because our towns are much older and much more compact, as we see on the map.
Speak into the microphone for us. Thanks.
Get comfortable here. I'm a bit tall for this thing. Yeah.
That's only for the video.
Yeah, just for people at home later on to hear you.
I'd like to thank the planning board. I don't think you guys are extreme. I think that you've actually been very thoughtful and unextreme. And I'd like to thank the ordinance subcommittee and the planning board for trying to work out the best arrangements for these zoning rules. It seems like a lot of other things are getting dragged into it. You know, we've relitigated the entire election. We've heard from a lot of people that didn't vote for it that probably have never and will never smoke it. But there are consequences to elections, and the consequences for this particular vote is that cannabis is legal to use by adults. It's their right, their civil right, and like when gay marriage became legal, we don't say, yes, it's your right to marry another woman as long as there's no children within 500 feet. There might be a wrong perception. There are people in this town who are strongly against gay marriage, but we don't use our city rules to discriminate against those legal marriages. And we can't allow this ordinance to codify similar discrimination. I understand that the schools are going to have to recalibrate their message on cannabis. It's been difficult. There's been the war on drugs and various other phases, and the messaging through the schools has been pretty good about trying to keep children away. But it's going to have to change now. Things are changing. I have a couple of suggestions about what we can teach the children. Foremost is that we can teach the children that according to the law, pot use is not wrong. We can teach them that settled evidence shows that statistically, despite our best efforts, some people in our city are going to die early, tragically, due to alcohol and tobacco use. But statistically, none will die of cannabis use. We should teach them that when they are of age, cannabis is a viable alternative to alcohol and the damage that alcohol can do to their lives and their families. Part of the reason that we're creating a regulated marketplace is to be able to soundly keep substances from young hands. Our school children walk in by themselves and buy candy in the same stores that openly sell alcohol and tobacco. They're taught that they're not allowed to buy certain things. And we need to teach the children that their family members and people in their church or at the supermarket that use their civil right to smoke are not to be avoided or kept away from children. I understand the use of school buffers for sex offenders, but unless there's evidence of danger to children, then buffer zones are simple discrimination against certain kinds of people. What is the message that having a buffer zone would send to children? That myself and other people in this room who need to be kept away from children, that using the city codes to discriminate against some kinds of people in our town is okay if you can rig it. Yes, it might feel new and it might feel fast, but it's been a year and a half since the election. The schools have got to get up to speed on their educational message on cannabis, because the school's lack of preparation is not grounds for our city to enact a system of organized discrimination. Further, Easthampton is a small city, and buffer zones around schools and daycares leave little space to cite our legal businesses. I'm concerned that our real estate market may get distorted, that by creating red light zones, we may be pressuring the current residents of those zones, that pushing everything into small areas. Now that's new, and that's extreme. I don't believe there's any rules right now that say that some of our residents are allowed to go in some parts of town and not others. And I urge you caution in creating zones of discrimination in our town. I don't think it'll hold up legally eventually. Buffer zones would essentially create red light districts, which Easthampton is not all about. I ask the council to strike all language from this ordinance which creates stigma and discrimination zones against legal cannabis users. I understand that this differs from the state's suggestion, but Easthampton is not like other Massachusetts cities, and a one-size-fits-all does not work in this ordinance. That's all I've got. Thank you.
Thank you. Okay, is there anybody else that wanted to speak that had not spoken yet? Sure.
We can also get a line too.
Yeah, if you want to line up, we can do
You guys
that
wanna-
too.
If you want to speak, you
A
can just.
line?
Yeah.
It's crazy.
Yeah, we do it all the time. Line is it's a queue. It's in the
It's a
ordinance.
long queue.
I want you to know, my name is Christine.
I can't hear. I'm sorry, just one second.
Sorry.
Okay, please go ahead.
My name is Christine Brain-Futia, and I live at 73 Garfield in Easthampton. I want you to know that my brother who just spoke and I did not in any way exchange notes. So if I repeat some of his points, I want you to know that they represent my separate view as a recent transplant to Easthampton and New England. Some people like to relax in the evening, with a glass of beer or wine, but some prefer to relax with cannabis, and when I have a choice, I much prefer the latter. I'm 61 years old, born in 1956. In my lifetime, cannabis smoking has gone from an illicit underground activity to a normalized recreational option. To those who are still fighting against the normalization of cannabis use, I'm sorry, but that train has left the station. Before the people of Massachusetts voted to legalize recreational cannabis use, it was already normalized. The vote in 2016 simply reaffirmed this reality. Relaxing with cannabis is an activity that stretches from sea to shining sea. It's a feature of ordinary life for millions of Americans. It's a part of our social fabric. Here in Easthampton, we have a multicolored, multi-textured social fabric. It's a beautiful thing, and yes, we are an outlier. Let me say this again. Legalization of recreational cannabis in Massachusetts is a consequence of normalization, not a mechanism that will lead to normalization. Now, I think that we can all agree that cannabis or alcohol or tobacco use by young people is not something to be encouraged. Some of our prior speakers have identified a number of risks and potential ill effects of cannabis that we as parents do not want our children to experience. We all want our children to be clear-headed so that they can learn, grow, and develop the way that they're meant to. Now, I have been relaxing with cannabis since I was in my early 20s, and that would add up to about 40 years now. Your glass of wine, my cannabis. As the mother of 3 children, I was certainly aware of the potentially detrimental effects of alcohol and cannabis on my children, and I worked hard on many fronts to keep them sober and pointing forward. My children actually didn't know that I relaxed with a little bit of cannabis every day until they were nearly grown. And today, the oldest 2 are 30 and 28, and the younger one passed away here in Easthampton a few months ago. I know that at some point in their young adulthood, each of them tried cannabis, but today none of them are interested. For that matter, they are also very light users of alcohol. Now, helping my children stay away from substances that might affect their development or thinking was my job, not the school's job and not the city's job. It was my job. Programs that helped them find good ways to say no to things that might be harmful, those were great, but it was still my job. Given the facts about cannabis, its level of acceptance in our society, and our vote to legalize, I've been shocked by the attempts to hijack this debate about implementation of our law. For almost 18 months now, many have done everything possible to slow or stall implementation. Many town governments have kicked the can down the road despite a clear signal from their voters that the time is now. And it's going to take another year for a business to open once our regulations are established. For heaven's sakes, those who are begging you to go slow have already gotten their wish. Given the reality that I just outlined, I would like to talk about equity and constitutional rights. When you talk about putting cannabis businesses far away from our town center, in buildings with no signage, with darkened windows so that no one can see inside, you are shaming and stigmatizing me and every other person who wishes to use cannabis instead of alcohol. It violates my rights and my dignity to have to hide in this way. When there are so many bars all over town with so much signage and lots of bright, clear windows. Again and again, our courts have reaffirmed that equity is one of our most important legal principles. Framers of our Constitution first established legal equity for people of different religions and social classes. Legal equity for women was deemed to be dangerous, but when this position was challenged on a constitutional level, it fell. The same thing happened with legal equity for African Americans. They were seen as a danger to our social fabric, too. Gay and bisexual and transsexual people were seen as a particular danger to our society and especially to our children. The equity principle applies to them too now. All of us are equal under the law, and inequity is on the wrong side of history. Here now, in Easthampton, Massachusetts, equity demands a fair and equal treatment of cannabis users and those who drink alcohol, of cannabis stores and package stores, and eventually of cannabis cafes and bars. We must not pander to those whose views defy reality, good sense, and equity in the name of compromise. I understand that you must operate within the laws of the Commonwealth of Massachusetts. But as you're finalizing our zoning law, I will hope that to the extent possible, if there is any property in this town that would be open to a new package store or bar, it must be open to a cannabis-based business. Any other position violates the principle of legal equity and amounts to bald-faced discrimination based on myth and fear. I expect the hours to be the same for cannabis businesses as they are for alcohol businesses, with the exception of medical cannabis. I expect reasonable signage for all cannabis businesses. I expect clear windows. I expect reasonable advertising of the products sold. If a bar or package store can advertise a special on a particular product to bring in more traffic, so can a cannabis business. The size, nature, and type of signage allowed for cannabis businesses must be the same as what is allowed for alcohol businesses. If neon signs are allowed in bars and package stores, they must be allowed in cannabis stores. Blackened windows are only acceptable if a new bar or package store would be required to do the same. And if the existing law provides for an exclusion zone around schools for alcohol businesses, then the exclusion zone for cannabis businesses must be no more. I hold you, our legislators, accountable for protecting my rights and the rights of all people who wish to use or sell cannabis under the law. As an adult cannabis user, I recognize and accept my responsibility to reasonably protect our community and young people from harm. I support all efforts to ensure that young people will have no access to cannabis through legal businesses. I support efforts to contain any smoke or gases emitted by cannabis users in legal establishments. These are reasonable protections. Anything else that discriminates cannabis businesses from alcohol businesses is unacceptably inequitable. Thank you.
Thank you.
Hello.
All right, before you start, I just want to ask everybody if we can try to keep this a little bit shorter, then hopefully everybody can get a chance to speak tonight. I think we're doing pretty well here, so just keep that in mind. That'd be great. Thank you. Sorry.
That's okay. Hi, I'm Becca Bolofsky from 53 Holyoke Street. I wanted to say we all hear about marijuana as a gateway drug. Cannabis has been my gateway civic issue. I've been a voter since I turned 18. I'm very much interested in current affairs and thinking critically, and I think we've seen a lot of critical thinking going on with from our members here. Also, the letters that you've gotten, I think they really represent this conversation well, and certainly the speakers before me tonight. I think it's really important to note that from the get-go, this discussion has been very unbalanced because we're not all starting at the same point of knowledge about cannabis. So I think we're hearing a lot of fear, like we want to protect the city, we want to make sure the children are safe. And I'm thinking, let's be clear, first of all, what we're protecting the city from. What are the dangers that we're worrying about? Now, I'm a mental health profession, and a lot of times when we work with people, if there's a real sticking point that feels kind of illogical, we don't just like plow ahead and go there. We go, let's take a step back. Things aren't really adding up and making sense, and there's a lot of emotion here, and we're kind of bumping up against this wall. I feel that way when we talk about protecting the city, because what are we protecting it from? I've heard the concerns about the developing brain, and I certainly agree with the science that we have access to. We all agree it's not for kids. Chances are your kids are going to try cannabis. It's going to happen. We want to prevent the use. I get it. But like everything, I think we need to kind of tone down like this mountain molehill thinking. It's really kind of outrageous, like all the fear that I'm hearing. I think we're overdoing it on that. It's not for kids. Are we worrying that we're setting an example so that maybe when people turn 21 and they're legally able to use this, are we saying we don't want that to happen either? Because there's a danger, I think, in that kind of thinking, if that's where we're going with all this worry about the children. I don't feel that that's fair to put on people's adult decision making, but I do feel education for young people is important. Now, a lot of you may not know the effects of cannabis. It's just a word you hear, and you see people giggling. I don't know what you see. One thing that I know is people use drinking as an excuse for bad behavior a lot. And that goes, I'm a lifespan psychology person. Like, I'm interested in the development of people's psychology and identity throughout the whole lifespan. So I'm thinking, how are we looking at this and what judgments are we making? And what are the effects of cannabis? For people who don't know, I am a cannabis user. I use it in a medical sense, and I also use it for relaxation and socialization. It's very different from alcohol. I have a real problem putting cannabis and alcohol in the same sentence, because although it's fine to use them both after the age of 21, I think it's totally different. The behavior that results from it, everything going on with it is really different. So I just want to take just a moment to tell you a bit about what happens when people use cannabis. It's really used for relaxation, chatting, talking. If you go in a place where people are using cannabis, it's probably going to be quiet unless people are making music. There might be some laughter. It's not as outrageous, the laughter that you've seen in movies or Reefer Madness. People are just relaxing. It's not a substance associated with fistfights, domestic violence, hitting people, pushing people, and sexual abuse either. It's not. You don't find people saying, I got high, I got stoned, that's why I crashed my car, that's why I slept with my husband's wife. It's not that kind of substance. It's just not. So when I hear about this fear, I think we need to rein some of that in and really look at what prejudice and ignorance is driving the worry here. So I think it's really careful that we not turn this city into, like we've said, the red light district idea. That really dirties it, sullies the city. I think people don't understand the wide range of variety of cannabis businesses, and I think people are just talking where, like, you can't begin to imagine what's possible, and it's not this terrifying, dirty thing that I think might be in people's minds, because that's certainly what's coming across when I listen, is this fear that's not based on things. So I don't want your kids using cannabis either. I just want to make that clear. And I will do everything in my power not to allow that to happen. As far as walking by this buffer zone idea, there's a really great grocery store I love frequenting in town. You can get your orange juice right across from the beer. I don't understand that. If everything that you're saying here is true, then I don't understand why this room isn't outraged about Big E selling the wine right near the eggs. I don't get it. So let me just quickly finish up here. And I came with a migraine, so I'm not as maybe put together as I have been in the past. I heard in a letter someone wrote they're disgusted by what we're doing. Again, disgusted. Like, where's that coming from? Okay. I think I've said my piece. I think it's really great to encourage cannabis businesses, and before we start ruling things out, I think we should say, what kind of businesses are we imagining here? My final point is, who would have thought that we would have such a thing as 3D printers? Could any of you have imagined such a thing? I couldn't. So we don't know the beauty and the excitement and the wonderful things that are ahead, but I think we should just talk more about what is rather than fear-based imagination. So, thank you.
Thank you.
Hi, Lee Shore, 53 Holyoke Street, Unit 1. Question about zoning and buffer zones. Does it have a reciprocal value? So basically, if there is a cannabis operation, that means that schools and daycares cannot be within 500 feet of them. So if they want to move in town or open a new place, that they're restricted from all of those zones.
No.
The other way around.
No,
So
but
they
that
can.
facility would be grandfathered at that point. They wouldn't then have to move after the fact.
Yeah, it's pre-existing.
Right.
So when you move.
Can the school open within 500 feet? Does the buffer zone go both ways? Okay. Let's just talk about perception for a moment. I think this incredible coming together of seemingly diametrically opposed parties. The biggest pushback for legalization of cannabis has been alcohol and big tobacco. And now I see education, big education, as a third party to that conversation. And the perception that keeping cannabis businesses out of, main business districts downtown says that we are making sure that all you can do downtown for recreation is things that have been shown to kill you. We're going to enforce laws that make sure you're allowed to go and do something that's going to tear things apart, or you can go and do something safer and gentler. And so I just wanted to kind of shine a light on that as well. Just this carving out and preserving this sort of bubble that says what you do in here is okay. That perception for kids, I think, is the concern I have. And just to quote the late, great Allen Ginsberg, let's not forget, pot is fun. Thank you.
Thank you.
Okay, oh boy, here we go. So,
Sorry? Yeah, can you give your name and address first?
my name is Taryn Brain. I live at 20 Plymouth Ave here in Easthampton.
Thank you.
Thank you guys so much for hearing me. You've already heard my father and my aunt speak tonight. And I'm also here to talk about family. There's a word I read recently, topophilia. Is that a real thing? Love of place, right? I mean, is that why we're all here? For the same reason? I think we're all certified, diagnosable topophiliacs, right? We might have our disagreements, but there's one thing that we all agree on, which is that we really all love this town. So when I was 18 years old, I had a galvanizing experience. I went to Amsterdam. My mom took me to Amsterdam. We saw the canals, we saw the museums, and yes, we saw the pot shops. Some of them were right on Main Street, and they were blasting techno music, oops, 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 But my favorite ones were these little sneaky ones that were just really magically filled with art, and you just get this kind of crazy creative energy. And for me, it was a galvanizing experience because I came back to the States kind of brokenhearted, thinking, this is something I would love to do that could never happen. And here I am standing on the precipice of a reality where that could be a reality. And that's incredibly exciting for me. So yeah, nearly 20 years ago, this has been a long time coming for me. So this is, this event in and of itself, this chance to speak is important to me. I did bring my son tonight. I don't know, some people might have noticed. Miles, you're being really awesome. Thank you so much. Reasons I brought my son tonight. No childcare. This is too important to miss. Being bored to death builds character, I think. And it's a good experience for him to witness this kind of boots-on-the-ground interaction with our local government. This is the kind of stuff that I want him to learn. But I also brought him because I need to remind you all that future cannabis business owners are also families, that cannabis businesses are family businesses. I'm afraid that limiting licenses could potentially limit small businesses. I think if we have less licenses, we may end up with more bigger places kind of dominating. There's only room for so many, so the more powerful can succeed. I've also heard of some really smaller, more creative ideas that wouldn't necessarily fall into the typical vision of a cannabis business, like the yoga studio that wanted to allow, smoking. They would require one of the licenses. So I think it's important for us not to limit that kind of creativity. I think you guys might be surprised with what kind of businesses come out. A massage studio where people are using medicinal oils to help people with chronic pain. There could be all kinds of things that are going to happen, but you're not going to be able to see that unless, you relax a little and let people be creative. I really want just to remind you guys that cannabis businesses are small businesses, and small businesses are family businesses. We're all here because of our shared love of the city, and I wanted to keep it really brief. I just want to say that I really do. I've been super impressed with everything that I've seen so far, part of the reason why I love this town so much. I trust the Easthampton government to navigate this issue wisely and carefully. I know that we're going to reach, a space where this is happening, and we're going to find a functioning way to make it work. And then once that happens, I want, them to trust us, the future business owners, the parents and the loving residents of this beautiful, amazing town to open appropriate, fitting, safe, fun, creative, awesome businesses that are going to contribute to the vibrant and amazing fabric of Easthampton. Thank you.
Thank you.
My name is Jean Hobby. I live at 9 Caroline Circle. In the interest of full disclosure, I'm a parent of an Easthampton High School student. I'm also a school nurse in a neighboring district. I'm late to this process and do not have any expertise on the issues related to permitting of any kind. Thank you all for taking this on. And quite frankly, have been ignorant about some of the challenges, and I appreciate all the speakers who've come forward. Because of this lack of knowledge, I Googled many of my questions, just like we all do, seeking to become better informed. The planning board, all the speakers from last week's meeting, the members of the audience, and those who will be watching at home deserve our thanks for taking time to examine the inherent questions. As has been discussed, the question of if was answered by the voters in 2016. The prospective and current business owners and those who have already invested their time and effort in community conversations about retail establishments are also to be recognized. The potential revenue to be generated in communities across the Commonwealth is also acknowledged. Now the hard questions appear to be how and how much. I crossed some of this out, but I decided to put it back in, so bear with me, and thank you, Mr. New City Planner, for answering some of my questions that I came with tonight. There was some discussion recently about the health effects and the placement of retail shops of consumable products, the consumable products for adults, namely nicotine in its various forms, alcohol, and cannabis. And I think we can all agree that there's significant research documenting the varying health effects of consuming nicotine in its various forms, alcohol, and cannabis on the developing brain. There was some discussion about the need to base decisions on evidence-based scientific research. I agree. While communities in other parts of the country may have established buffer zones without any evidence-based research, it appears that there is a lack of substantial research into whether or not buffer zones for the retail sales of cannabis are helpful. Could this lack of research be the cause of having no evidence? Buffer zones apparently have not been thoroughly studied for cannabis retail, have not been thoroughly studied yet. Rather than considering the limited research done in cities and other parts of the country, it would seem to be more helpful to do our own research, our own scientific research, into the impact of buffer zones on Easthampton. With this in mind, my questions include what plans have been discussed to assess this impact, and who will be responsible for this, and of course, how will we pay for this? There was some discussion about using revenue to support the need for educational efforts. I agree. However, there is significant evidence that shows that knowledge alone is not enough to impact perceptions, beliefs, and behaviors of any age group, especially those of the age with a developing brain. There was some discussion about the use of cannabis for medical purposes. Personally, I think this shows great promise for those who suffer from debilitating conditions, and I look forward to seeing the scientific research and more scientific research in this arena. However, the question before us is not how to permit dispensaries for cannabis to be used as medicine. The question before us is how to permit retail sales of cannabis as a consumable product. And it's taken me a long time to wrap my head around cannabis being used as both a medicine and a consumable product at the same time, which is something that our society apparently is doing. There was significant discussion about the 2016 referendum that was passed by a majority of voters, both statewide and here in Easthampton. I was able to find a copy of the full text of the original referendum the voters considered when they voted back in 2016, and this full text is available at a publication called Weed News, and it's dated October 18th, 2016. And there were some questions that I had in here that were in the original text that voters voted on in 2016. And just bear with me, I need to find my highlighted sections. And Mr. City Planner, I believe you addressed some of this earlier. In Section 3 under local control, it states under Section 1 and 2, Section 2 specifically, it limits the number of marijuana retailers to fewer than 20% of the number of licenses issued within the city or town for the retail sale of alcoholic beverages not to be drunk on the premises where sold. And you addressed this earlier when you talked about the number of package stores. So the proposed numbers are well above the minimum 20% that people have talked about. I have more. And of course, I can't find it. Somewhere in here, and I can't find it at the moment, there is a reference to the 500-foot buffer zone. The voters voted on a full text that stated a 500-foot buffer zone. And I just want to remind the planning board that this is the full text that people voted on in 2016. Both the buffer zone written as 500 feet and also looking at 20% as the floor for comparing to licenses issued to establishments that sell alcohol to be carried out. And as Mr. City Planner said earlier, and I'm sorry I don't remember your name, apparently there are 8 or 9 package stores here in Easthampton. So the 20%, the 4 that people are proposing would seem to exceed the 20% that was voted on by voters in 2016. So just to run by you, and then I'll cede the floor. Thank you. Questions that I'm asking the board to consider: can the local municipalities exceed the CCC requirements? Secondly, If a local municipality limits the number of permits to 4, can this be increased in the future? Next, if a local municipality sets up a 500-foot buffer zone, can it be changed in the future? Who collects the data regarding the effects, if any, of adding cannabis shops to our community and the impact of buffer zones? And again, as I mentioned before, how do we pay for the enforcement, product safety, and data collection? Another question that I thought of during the presentations, how are other communities handling the question of on-site social consumption, which seems to still be in the proposal that's being considered? And I realize the state is encouraging us not to address that at this time. Finally, with all of this in mind, I respectfully ask that this planning board support the requests presented by school officials to start with a 500-foot buffer zone and to start with 4 permits for retail sales until the impacts of these have been studied. Thank you.
What was your first question again? I got all of them except for the very first one.
Can local municipalities exceed the CCC requirements?
Thank you.
Thank you.
Hi, my name is Lara Gonzalez, spelled like Lara Croft or Lara from Dr. Zhivago, depending on what generation you are from. I am a first-generation Puerto Rican. I moved here when I was 4 years old, and I have only known New England. That being said, I was thankfully raised by 2 very educated people, and I have to agree with one of the speakers who said that how your children end up and what they end up doing is based on how you raise them. Mr. Greg Rowland had mentioned that he believes in a buffer zone. I am here to inform you that every day I went to school, I would walk by numerous gas stations with tons of pictures of happy people smoking cigarettes. Tons of gas stations that I would walk into that not only had orange juice, but vodka. And I can tell you right now, I'm 28 years old and I have never once abused a substance. I've never once abused alcohol, nor do I smoke. And having these buffer zones will not keep our children from doing what they want to do. It all depends on how you raise them. That being said, I am an avid cannabis user and very proud of it. I have been using cannabis for the past 11 months, and I wish you guys could see who I was before then. I was plagued by depression and anxiety, and I was in a very, very dark place. And then the elections came up, and in 2016, we decided to pass recreational use of marijuana. While I was not using marijuana at that time, I was doing research, finding out about CBD and Charlotte's Web, how this can benefit us on a topic that we as Americans do not want to speak about, which is mental health. And I can tell you today that I have made a 180-degree turn in my life. Cannabis has given me my life back. I went from being chronically depressed, not taking care of myself, to who you see today. Much more confident, rocking the short hair, which I've never done before. And because of the store that I am here on behalf of OrCare Inc., which we are hoping to open an establishment here in Easthampton, I can say that I would have never, ever imagined being here. Because of cannabis, I now have goals, I have dreams and aspirations. I have finally gone back to school at the age of 28. I had a full-time salaried job that I have taken a break from to reach my goals. My dream is to go to Northern Michigan in September to study medicinal plant chemistry. And let me tell you, my mother was very against me beginning cannabis use. I started with THC, and I do not call it marijuana because that is the street name. It is cannabis. Started by using THC. My mother did not like it, of course, like any parent wouldn't, because she was educated on the harmfulness of marijuana, but with my research, I have found that cannabis can help with type 1 diabetes, which CBD, all thanks to OraCare and Violet Hall, is helping my father with his type 1 diabetes. Anxiety, depression, which is assisting myself and my brother get through our lives and start achieving our goals. It helps with acne, which plagues many of us and we hate. But even those little things that you don't think cannabis can help with, it can. So my stance has always been that through education, we can teach the youth and teach each other what this plant can do for us. And if we start hiding this from our children, if we start showing them that these shops are a bad place by hiding their signs or darkening their windows, we're showing them that this isn't worth learning about. And the only way that we can protect them and also protect ourselves is through education. And I have been fortunate enough that I know about Google, and I have mostly self-educated myself on the benefits of cannabis, but also through Violet Hall, who has been a vocal advocate of cannabis for the past 20 years. OraCare in Springfield has become my second home. And as someone else said, the cannabis community is like a family. And when you are struggling through depression and anxiety, you feel so alone. But the moment I came into the cannabis community, everything became bright, and I had hope. I hope you guys will make the right decisions. And I hope that through education, we can help everyone understand the benefits of this. And at OraCare, which has been operating in Springfield for the past year, through education, we have been able to help hundreds of people. Now, when it comes to monetary gain, did you know that in the past 4 years, Denver has accumulated $506 million due to cannabis retail sales, as well as taxes and licensing fees? Unfortunately, are not the size of Denver. Doing this will definitely help stimulate the economy in Western Mass. Imagine what that will do to our horrendous roads. Imagine all the books, all the computers, all of the help that we can give our students through the retail sale of cannabis and through education. Thank you.
Thank you.
Good evening, everyone.
Yeah.
My name is Violet Hall. I am from Southwick, a local farmer. I am OraCare. We are hoping as a business to come into Easthampton and open up a store. We would like to do a micro grow right here. A micro grow right here in your town. We are now securing space, and these are the products that we do already. We have been farming and researching CBD and hemp products for the last 7 years. We have all the data that proves it. We have all the information on each product. We help over 3,800 people a month to date with CBD alone to this day. We are growing at a rate we cannot keep up. We have went to numerous towns. We have searched, we have watched, we have looked, we have not jumped. We want the correct fit. We do not want to go into any town that we feel as if is not a fit for the upcoming communities of cannabis in today's society. We are not hiding, we are not standing back. We are coming forward as an industry. Yes, I have 7 children. And I have raised them. And we have raised them on our farms, and we have taught them how to use the machinery, how to plant hemp seeds, how to grow. We are creating a multitude of open jobs for our children to grow and learn. We are hiring scientists. We are hiring nutritionists. We are hiring people coming into your community with educational background in exercise, in yoga, in grow facilities, in master grows. We have traveled the world for quality seeds. We have went to country to look at grows, to distinguish ourselves between a small grow to now a micro grow, to produce quality USA made products right here in Easthampton. These products here are saving lives. These products right now only contain 0.1% THC. But because of the stigma today, and because of the fears that we see, we cannot put all our grow outdoors to grow our product because of theft. We have decided to go for a micro grow production license to ensure that we can provide quality care for all, whether it be with some THC in it or just CBD. Our goal is to come into your community and grow with you and hopefully produce economic growth and development. We do educational classes. We work with 11 doctors. We discuss how it is going to turn out with the community. We have been to the Cannabis Coalition meetings. We have sat in and listened. We have done our homework. Now is the time to not be afraid. Now is the time to understand. Our children is upcoming. Our children are the ones who are going to be doing this. We have to teach them that this is not something to fear, but something to understand as any other product we deserve to have in our systems. Today I would like to just thank you for letting us talk and share, and thank you for letting us come into your community. And we have decided this community is worthwhile. This community is needing economic growth for the small farmers to come in. Real farmers. We are real farmers. We do our meats, our vegetables. We rotate our crops. This is what we do for a living. So I hope you take that into consideration when you think about the new store we will open up. And we will hopefully be going for our micro grow license for this community. And hopefully you will be able to know our face. Thank you very much, everybody. And thank you to my staff, and Seth, and Mark, and Laura, and Jackie, and Dave, because they have done a wonderful job, and they have fought hard.
Thank you.
Thank you. So we reached the hour limit that we set. I know there's a city council question, so you can speak. We'll hear from you, and then we'll be done with the public comment portion. That's fine.
Appreciate it.
Thank you.
And any comments that we haven't heard, we would.
There's going to be emails, but there's also going to be the process we discussed earlier at the city council. There should be further opportunity for people to speak there to the city councilors before they ultimately vote on the bylaw.
I have mostly questions and a disagreement with my good friend, Councilor Derby. You sent us a pamphlet, which was very informative. In there was a paragraph dealing with the local work on ordinances does not have to be rushed by April 1st. It does not have to be done at that time. And I'd like, Mr. Bagg, to check this out, because I don't believe that we're going to get this done, or nor do we have to, by April 1st. We might have to wait until the first or second meeting of the City Council in April. And the reason I say that is because we want to do this right. There's a lot of disagreement, and there's a lot of feelings. So I'd like you to look into that, because that pamphlet you sent, and I'm sorry, I should have brought the paragraph with me, did indicate that we could go as far as June before we had to have everything done because of the zoning regulations don't impact the licenses until that time. So I will send, I don't know if you sent that to him. Do you know what I'm talking
I do know
about,
what you're
Salem?
talking about, yeah.
All right. That to me encouraged me that we didn't have to rush this till April 1st. And I'm saying that only because I'd like more discussion amongst all of you after the March 15th date that you're going to get the final regs. I do not want confusion and conflict between our regulations and that comes out of the state. For instance, we just heard that social consumption might be delayed a year. So we shouldn't have any regs in there for that.
Why?
Should we? Well, maybe we should. Okay, but I'd like to know more about that after we get the final documents. I'd like to see that. And I think you're going to need to meet, maybe as a group, and I want to know why you can't. Why can't you meet again after those regs come out and discuss it? Is there any reason why that can't happen? Is there any
I think
deadline?
we do need to look at the timeline, which was triggered.
You have to have a
I was under
public
the
hearing.